Thank you, everyone, for bearing with us as we had to take care of a few technical issues back here. But good afternoon, and welcome to our second track of the day. This track looks at how business models have changed, sometimes radically, as a result of the COVID-19 pandemic. If you haven't met me before, I'm Kristen Hannock, a senior analyst here at Parks Associates. I lead our research in connected health, designing and authoring our research projects, moderating and presenting at our events, and regularly speaking with industry executives to help answer some of the biggest questions impacting the health space today. Before we get started, I'd like to give a special thank you to our sponsors, Alarm.com, Everrise, and Essence for helping to make this event possible, as well as our supporters, CEDIA, Connected Design, DealerScope, SCTE, the Monitoring Association, Z-Wave Alliance, Broadband Communities Magazine, ESA, Health Tech Insider, and Emma Health Times. In terms of the agenda for this day's track, in the next few minutes, I will be presenting some of Parks Associates' findings on how the market has changed over the past 18 months. Next, we'll be hearing from Michael Braun, CEO of Trapollo, on healthcare transformation. At 2:45, Renee Dua of HEAL will be participating in an executive Q&A with our own VP of Research, Jennifer Kent. At 3:15, we'll be doing our interactive panel with Tori Ames of Cincinnati Children's Hospital Medical Center, Brian McQuaid of PlushCare, Sean Mara of HealthTap, Rob Schneider of Omron, and Pete Stevenson of eCare21. Finally, we'll end our day at 4:15 with networking discussions in a private chat room. If you have questions for our presenters or panelists, remember to get them in early. There's a submission box to the right of your screen. Shifting business models. In the past 18 months, we've seen radical changes throughout the healthcare space. The markets for telehealth and connected health products in particular have been greatly expanded. Almost 2/3 of US broadband households report having done a remote healthcare visit in the last 12 months, an exponential increase compared to 2019, pre-pandemic, when only 15% reported having done so. And very many US broadband households say that they would use telehealth in the future as well. Among those ages 24 to 44, the millennial generation as of 2021, over 3 in 4 report that they are likely to use telehealth the next time they are sick. And in the second quarter of this year, connected health device adoption broke into the majority, with over half of US broadband households reporting owning devices with health tracking functionality, such as smartwatches and other wearable products, connected fitness devices such as the Peloton or Nordic Track, or connected medical devices such as CPAP machines, blood pressure cuffs, or pulse oximeters. Majority of consumers have now experienced digital and connected health in their daily lives. It has become the new normal. This massive expansion in the digital health, connected health, and remote care space was really helped make possible by the actions of regulators and payers early last year. Where before telehealth visits were mainly limited to a small list of acute care options and primarily done through ad hoc, single-time visits with providers, this all changed in early 2020 with the advent of the COVID-19 pandemic. Seeing the potential impact of disease spreading rapidly through medical centers, the Centers for Medicare and Medicaid laid out a series of COVID-19 emergency response measures. The list of conditions that providers could consult for remotely drastically widened, and more types of providers became eligible to participate in remote care. People were able to consult with their primary care provider or other providers they had long-term relationships with. One of the biggest impacts was CMS removing the restriction around originating sites for the Medicare population. Seniors no longer had to drive to a special location to be able to do a remote visit. And these visits were reimbursed, many of them at a similar rate as an in-person visit. CMS also temporarily waived HIPAA compliance for the delivery of virtual care. Some of these changes have been made permanent, and others are likely to be made permanent next year. As a result of increased reimbursement, increased adoption, and increase in awareness, new markets have opened up in healthcare. The provider space is looking for long-term telehealth and remote patient monitoring solutions. With the move to telehealth happening virtually overnight, many originally turned to consumer technologies to be able to conduct visits with their patients. However, these consumer solutions are not HIPAA compliant and are not well integrated with providers' IT systems. They will need to be replaced, or providers will put themselves at risk in terms of compliance once the COVID-19 emergency is done with. And also, as a result of the shift to remote visits, providers are increasingly recognizing the gaps in care. There is a need for biometric data and platforms to interpret and monitor that data. remote patient monitoring, and remote diagnostic programs. Many care organizations are looking to RPM with the intent of rolling out full-fledged programs in order to fill up these gaps in remote care solutions. In the psychology space, we've also seen this enormous uplift in what has been termed telemental health services. Even between 2020 and 2021, the user base of tested services has increased by up to 50% in some cases. Telemedicine and virtual care are particularly good fits for therapy, removing many of the barriers that prevent patients from seeking care in the first place. And unlike other forms of medicine, biometric data isn't really all that necessary with therapy. As I mentioned before, we've also seen notable increases in the direct-to-consumer market, with consumers becoming more engaged in their health and willing to purchase products and solutions. Some of this was driven directly by COVID-19. Products that have features such as blood oxygen detection and heart monitoring were and are in particularly high demand. Adoption of smartwatches in particular has grown, with roughly 28% of US broadband households now owning one. However, uncertainty still remains. The COVID-19 pandemic continues to really spread across the United States and across the globe. And many locations are currently in their largest wave so far in terms of hospitalizations. ICUs are running out of capacity, and some locations are finding it highly challenging to meet patient needs. Staff are burning out everywhere, and many are quitting and leaving the field. The Delta outbreak is having an economic impact and business impact to the healthcare system. In the short term, solutions aimed at solving these issues are vital, and their adoption may very well have further long-term impacts. However, even as Delta rages, the pandemic will eventually end. When that happens, the state of the emergency and the measures put into place because of it will also go away. What the post-COVID regulatory space and economic models will look like are still uncertain. The Centers for Medicare and Medicaid, CMS, are the largest payer in the United States, and where they lead, the market traditionally follows. We can look to the 2022 Medicare for Physician Fee Schedule proposed rule set out by CMS to see what they propose for next year. However, we still do not know what the reimbursement rates will look like for telehealth services or to what degree audio-only visits will be supported. We don't know if patients will be required to visit a provider in person from time to time in order to be able to conduct televisits with them. And all of these uncertainties are certainly factors that matter for providers, for patients, and for the vendors serving them. In summation, the business case for connected health is much better than it was a few years ago. The fee-for-service space is important. This is how many providers and health centers earn the majority of their revenues still. And it certainly continues to drive much of the market. However, even with the changes that have been made, some businesses and business models are and remain incompatible with fee-for-service. This is particularly true for solutions that ultimately lower patient demand and the overall cost of care. For these solutions types, value-based care remains preferred. Meanwhile, the direct-to-consumer market has experienced a resurgence driven by increased consumer awareness and familiarity. It's a good time to be in connected health. And that's it for my presentation. Next, I would like to welcome Michael Braun, the CEO of Apollo, a Cox Communication business. Welcome, Michael, and thank you for joining us. Please go ahead, take it away.
Great, thank you all. And I'm excited to be able to talk today. And one thing that's been interesting is you're going to, I think, hear several consistent themes from the earlier speakers and even with really how this session was set up. What I'm hoping to do is to pull a lot of things together. I want to give you also an understanding of where I'm coming from because it's going to be I'll say a non-linear approach. I started off my career many years ago as a Marine Corps fighter pilot. And as I wanted to introduce that concept, it's because some of that experience really from years ago still will weave through the relevance today. Part of that also is that right after the first Gulf War, I left the military service and was medically discharged and have been operating essentially in the world somewhat of a disabled vet for a number of years. I understand the veterans, the VA world pretty well, understand the commercial side of healthcare pretty well, both from lived experience, but also as a provider. Over my career, I've also spent a good amount of time in both the cable world, essentially, and the regular telcos. I've also spent time leading organizations to where behavioral health was really the focus of our care across not just the United States, but around the world in dealing with veteran issues again, both in the PTSD and suicide prevention side. Behavioral health is something that's really close to me. And then also now on the physical health side, to where we're dealing with the opportunity to pull together a number of different technologies that I still would say today are not truly connected. But what I want to do today is to put together some of these elements, some of which are maybe obvious and some of them are not. I want to be able to provide some thoughtful and maybe a little bit pressing ideas towards the future. I think there's a lot of opportunity for us to accelerate. I think there's so many opportunities for us to lead, and really the two major themes that I want to bring to us today really is to both expect future change, but not let change happen to us. Instead, lead through change. And I would ask folks the question, essentially, oh, wouldn't you know? There you go. Why does either a person or an organization change? Now, to me, that's an interesting question. And the answer that I've come up with, some of you have heard this in the past. Either a person or an organization, they either see the light or they feel the heat. I've been giving these kind of presentations since about 2008, have been able to see where a lot of things, the potential, and as we heard earlier, we know that technology's been there for a while, but there was not the opportunity to align policy and regulatory and how people were going to get paid and a whole lot of things. And then lo and behold, we saw that everything had changed as a result of COVID. We were in the midst of a healthcare transformation that really started with a whole talk around digital revolution. How are EMRs being implemented over the last bunches of years? How are regulatory change, slow as they may be, were they helping to provide new alternatives towards healthcare? And then one of the comments that I'll talk about a little bit more in depth too is the patients as consumers. We're seeing that almost every other industry has been affected with consumerism, but not as much really in healthcare delivery. We're learning about personalized medicine and then this other area, which is so funny, called the Amazon effect. And that is so much of our culture right now is focused on what can I get within 24 or 48 hours. They want everything now, or they want to be able to have access, and yet our systems were slow to make that happen. And then the center of care was beginning to shift. Essentially what we were seeing really way back in about 2010 was that as of January 1st, 2011, the first boomer turned 65. That's about the time we also were creating the term the silver tsunami. The demographics were coming ashore. We couldn't do anything about them. We had to be able to respond differently. Aging in place was just starting to even be a concept. And so all these healthcare disruptors were in play. But really, there was some adaptation and adopting to new ways of really delivering care, or even how you might want to receive it. We're being challenged. But in an article really last April in 2020, I got quoted to say what we thought was still going to take 5 years when we were looking at it in February actually happened in the first 5 weeks of COVID. And so what we've been able to do and see is all of this adaptation occur. We were adapting and we were adopting. And part of the story that I bring when I was telling you about, being in the military and then having the experience in telecom and now in healthcare and others, was I also experienced really also as a patient. And that's the interesting and fun thing about healthcare is that, many of us are involved in the healthcare industry, but one way or another, we're all still patients. And one of the things that I was experiencing, and I don't mind sharing my own story along the way, as we were looking through the challenges of how we would react to, let's say, the lack of care, the ability to get to a doctor's office. On February 28th of last year, when I was on a business trip in California, and I live in Virginia in the DC area, I had a back injury that literally caused me to essentially be incapacitated. I was thrown onto an airplane, said, let's get him home. The reason I remember it was February 28th, because 2 days later, essentially, California was closing down, healthcare was being restricted. I had some need for surgery, and yet there was no ability to get surgery. I had to wait months and months before that would happen. Now, in the era of the pandemic, I've now had 4 spinal surgeries in the last year. And when I saw the first section of this morning, they were talking about, robotics. I was actually one of those patients. So during the midst of the pandemic, trying to lead a company focused on telehealth and providing all of these solutions, and we were doing it on a national scale, I also was trying to operate as a patient. And so one of the things I was able to see in my own world is that in preparation for the surgery, I was able, through some innovation at the time, to both see a hematologist, oncologist, a neurologist, about every kind of gist you could imagine, because they wanted to be sure that if they actually were able to provide surgery, is that I would be able to have all the prep. All of those things happened via telehealth. I was able to experience not just from how we would deliver it, but actually receive it. And this is where I think that right now what you're seeing across the country is so many essentially early adopters. We've not yet seen some of the fast followers. And so what my recommendation here right now from looking to the future state is to take a period of time where we can consolidate and stabilize the connected side of connected health. There's so many elements that are individual and wonderful, but we've really not been able to pull together yet to how we connect everything from someone's home, let's say, all the way through to the insurance companies and the health information exchanges and everything else. Those things are not all connected yet, but yet the quadruple aim is still there, something for us to say, what can we do to enhance that patient experience like never before? How can we still drive down the costs and improve the outcomes? And then the thing which we've seen now more than ever because of COVID is improving the clinician experience of dealing with now more than ever burnout and frustrations and so many other elements of those that are delivering care. The other side of this as we're looking at, is really understanding, and we've heard it a few times today, consumerism in a provider-centric world. We have to be very much focused on access and availability and affordability of healthcare. I'm a really strong proponent of both urban and rural underserved communities, and how can we provide a number of different solutions in those environments. But how do we be able to focus more on not just the delivery care, but how does that consumer receive it? And we know that right now, a lot because of what's happening in the COVID world, a number of new telehealth and RPM providers are showing up almost daily, it appears. And though how would any of these systems come together? And one of the key areas to where, again, I said way back in about 2010, we started talking about aging in place. It is now, as a part of one of those exploded norms, is to say we thought that there were stereotypes that said certain age demographics, especially the very senior folks, would not adapt to a lot of the telehealth environment. Myself, as I told you, I was a patient. Well, so are my mom and dad. My dad's 89, my mom's 85. My 89 and 85-year-old parents were also experiencing telehealth, dealing with their issues, comorbidities and whatnot, all in a telehealth environment, because they were essentially locked down into the facility to where they have a wonderful place in a senior care facility, but they weren't allowed to leave to go anywhere. So when I looked at this is that we're looking at the home, and whether it's, let's say, in the senior care facility, as is their home, and or in their more traditional home, is that seems to be the largest untapped area that we can gather data. Gathering all of this information, gathering things to which we can be able to use and provide better care closer to those that want it in a consumer environment. And the most underutilized asset in the home, as we all kind of know, is the television and the remote control. Those things are still on their way. There are certain organizations which are really looking and seeing how can I, use those two tools in some unique and colorful ways, but that is still essentially aspirational. We haven't seen that come to market quite yet. And the ability for us to integrate multiple data sources is really important. Right now, we've heard, whether it be the Fitbit or other individual elements of data, the part that I want to talk about a lot in just a minute and I'll forecast a little bit. It's really called data as a service. It's what I'm going to recommend today would be in a futuristic state of a way of pulling a lot of things together. Because the part that's so interesting to me, both as a patient and then also now as a part of the provider world, is that things like the electronic medical records, they're used abundantly inside of that health environment. But as soon as you leave that brick and mortar environment, the EMRs go blind primarily. And in this environment right now, I think this is one of the key areas where when we can connect all of the elements along the continuum of care, we have a dramatic and important way to reimagine, to redeliver, to repurpose a lot of the assets which are yet aligned. Now, the part that I want to be a little bit inflammatory to make a point, and I put here data as a service, and it's on the horizon. I like to pretty much say that I hate data. And then just to pause for a second, why would anyone say right now they hate data? Well, we are aflush with data. We're overwhelmed with data, but what we don't necessarily have well at all is actionable information. And that's really one of those key areas that I think will help to transform us. And that what, again, to be a little bit, exact, is we've been focusing really in what we've called healthcare as sick care. We've been dealing with people that are presenting as being sick. And I think one of the true opportunities for us yet to realize is that as we can take data, converting it into actionable information, that we can actually propel the change in both the individual receiving care as well as how it's delivered as a transition from sick care to healthy care. And as that is one of the ways that I think collectively we'll also be able to look at the quadruple aim. And when I'm talking about transitioning and going from sick care to healthy care, the top line here really kind of talks about more of the environment today. We have some element of wellness, probably not well adhered to. We know that people will show up either episodically or at times acute into the healthcare system, but they get treated, they go back. At times, I know we're looking in my part of the business to understanding and helping more in the rising risk environment, because if we can get a hold of that, then maybe we can help be more proactive in the chronic illnesses. We know that 75% of the chronic illnesses drive a significant part of really the $3.7 trillion. But then the other side of this that often hasn't been talked about until just the last year or so is that when you look at those top 3 or 4 chronic illnesses and combine them with behavioral health, now we're really looking at almost 90% of those dollars are being addressed to really those top 4. And then often it's the comorbidity side of this that I really want to talk about here in a second, in a maybe a little bit more energetic way. I think that there's so many opportunities for us to look at how would we change how chronic and comorbidities are looked at as we would change and involve more with connected care. And that might be to be able to have a more established baseline as someone is earlier in their life, to be able to focus on preventative side and to put some onus upon the patient themselves as well. I think it's important to also understand that when we're talking about social determinants, in one of my previous jobs, we were talking about the social, and the financial determinants of health, and how they all kind of pull together and more broad than just even the social determinants. But isn't it interesting how just in the last few years, we'd never talked about such thing. And now that's one of the key focuses really over, again, the last 18 months or so. So the lifestyle matters. And then I say early warning. And this is where I want to kind of pull together some of the reasoning of the fighter pilot story, is because I've been really since the 80s when I was flying and then taking it into the 90s. And I've just aged myself, obviously. But early warning has been something to which we've been involved with for a long time. One of the career steps that I took after being involved with the military was to be involved with crisis management right after 9/11. I was able to look and see and understand how being able to pick up signals early, being able to understand where and how things would change and how fast we could react could definitely play a larger impact in how we would build solutions. And so as we're looking right now, and the reason I'm talking about, all of these different elements is that this is the change which has been thrust upon us. So dealing with the digital transformation, the CPT codes, really trying to figure out about cost containment, and then the physician shortage, Any one of those by themselves is a big effort. But as an industry, what I'd like for us to do is we're going to be able to look and understand how to really maximize connected health is to deal better with change management. Because the thing which we've also learned along the way, and it's really, I'll say it's the workflow, it's the workflow, it's the workflow. Everybody that I know, we have really cool tech and we want to take it into the healthcare providers or into, an insurance company that has case managers and whatnot. And really what I've been able to examine right now is that there's change fatigue. I heard from one particular provider and she was saying to me, Mike, this is like the third or fourth or fifth thing that our company executives are wanting us to do right now. We just can't learn anything new right now. We're overwhelmed. We're fatigued. Combine that now with COVID and the provider burnout side, and we have some real challenges. And I think it's just really important for us, a lot of us as technicians, as technologists, as clinicians, and as physicians, is to realize cool tech not used really just diminishes the outcomes. It delays results. It costs both personal time, often political capital, and even just the results that you're looking for. But most importantly, it really diminishes that patient engagement. And for us, when we're talking about how we can start to shift our whole industry, it's to realize that patient experience is going to be a larger and larger part as the patient and moving into consumerism is more important. It's for us to understand that there are going to be plenty of competitors wanting to help in different ways that will be able to use things in a different way. And much like we've been looking at some of the large players, and we heard them earlier today, the Googles and the Amazons and others, they're very consumer centric. But yet in our world, it's still acceptable to say that you have to come to my office for me to treat you, or still acceptable that you make a call at noon and the call center essentially has shut down. We're all out at lunch. Please call back at 1. I mean, there's some things that just are not as workflow friendly and for either for the patient and or for the organization. So we really need to focus more as patients, as consumers, patients that really are coming much more informed than ever before. Almost every doctor that I talk with says they always, patients are now coming to me. They've already Googled all the things that they think are wrong, and then they're well prepared and trying to ask more questions. We know that consumers, they prefer options. They want to be sure that I can either get treated when and where I want, or how I want, or to be able to ask more engaged questions. And the expectations are that will only get more as the patients are asked to be more involved. And if they're not involved for themselves, to be more involved with, let's say, their loved ones, their parents, their children, and whatnot. So the question that I've been asking over the last couple of years is that when we're trying to figure out whether it be a face-to-face, or definitely when we're talking now about that older segment of the population, is who is the physician talking to? Here's why I set that up that way. A couple of years back, as my own family was going through a parent that was suffering regrettably from both COPD and from leukemia, my wife's mom was going through all of this in a distant area. She was down in Florida. We were up here in Virginia. My mother-in-law is also Hispanic. So what we have was some language challenges. We have some challenges with how and where care was being delivered. And we also had to deal with how the questions that some of the doctors were asking were relevant. Back that time, I was working for one of the major insurance companies, and I was watching how all of this information was being pushed out from the large payers to essentially, let's say, my mother-in-law's mailbox. My question to our own company was, who are you talking to? Are you talking to the patient? Are you talking to the adult caregiver? Are you talking to the adult child, let's say in the Hispanic community where the eldest female child is often the one would be pulled into that environment of decision making? Are we understanding how and where we're meeting a patient's needs and or those key folks that are stepping in for them? How many different physicians is that patient seeing? Our AMRs still aren't pulling all of these things together quite yet. And then the last part of this, which again, back to why I'll keep weaving the whole idea of behavioral health into this, is, does the patient have behavioral or physical comorbidities? So as a Marine Corps veteran, my leg got trashed. I thankfully still have it. Many of my other friends, when they came back, and even as we've seen just in the news in the last month or so, even in the last week, as someone would come back with maybe, let's say, a severe injury, maybe even the loss of a limb, it could be expected that that person may also have PTS, that they may have other behavioral issues, some challenges that they have to deal with. What I would recommend for us to consider as well, and many of us have lived through this as well, I could be really fine right now, but if I, after this, was to have, let's say, a doctor's appointment at the end of the day, and that at the end of the day, I realize that now maybe I have a disease that is going to be life-ending, or something that's traumatically changing the way that I live, you too very well will have a behavioral challenge that we have to deal with. We know that when we look and talk about some of the big ahas coming from COVID, it's that we see specifically for the older community, when they don't have that relationship, the behavioral health side impacted the physical health side, and then the physical health side often can impact the behavioral health side. So I'm wanting to pull all of these things together and looking at the total patient and looking and understanding, are you talking to the patient? Are you talking with the caregivers? Are you talking with all the people that are impacting the overall health? And then what are we doing to treat that total individual? And so change management to me is something that's important for us as clinicians. It's also change management for the patient. We're dealing with clinician shortage and burnout. We're worried about, as a patient, what will happen as I go through the healthcare environment, going to the hospital, will I get sick? Will we be able to maybe even go back old school to return of the house call, but to do it through technology? All these things are so new and interesting as we go forward. So I wanted to see if anyone is still awake. I put in this picture. This is a picture of essentially the cockpit of the airplane I used to fly. It's called the Harrier jump jet. Many of you have heard about it. It hovers, it goes fast as a jet. I wanted to show this because this is an example of what I would say is data overload. Just imagine trying to keep up with all of these different screens and pieces of information and all these other things. Well, we might be able to see from this picture, there's actually a plane that's already taken off in front. That's essentially either going to be the lead or the wingman. But you know that primarily all of the data that's in here right now at times becomes so overwhelming that it's hard to process. Excuse me. And what we used to say, it was that even though we would be flying, we'd go on a mission. If there was all of this information around what might be ahead, but yet someone fires a missile, we used to say the missile that shoots you down is the one you never saw coming. And so I want you to think about that for a second, because so often when I think of that same analogy brought into the healthcare world, it is that illness that you never saw coming, or that activity that you never saw coming that was going to be informational. How can we use these early warnings? How can we look at the total person, the situational awareness, a 360-degree bubble around the person, and provide an early warning system that's more effective than ever before? So I mentioned that I wanted to introduce the topic of data as a service. There is so much information. There's so much data that exists out there, but yet we've not pulled it all together yet. We've not been able to put together a solution that starts really from one side, which is dealing with the whole individual and moving it across to the continuum of care. What can we do to take data in different places, and not just medical data? Quite honestly, one of the things that's always bothered me is when we have a Fitbit and we all talk about, hey, how many steps did you get? It's great to know that they have done enough good marketing that says 10,000 steps is what you want to do. But I'll ask you, if you only did 847 steps today, so what? Do you eat less tonight? How many calories? Do you need to do more steps? Do you need to do other information? We have to do all the processing just in our own mind. Well, quite honestly, that might be one data element. What if the 2, 3, 4, 5, 6 different data elements treated individually? It's not necessarily important. But when they have now a relation, what is the impact that you can now look at diagnostically to know that you are now looking at number of elements, so that when A plus C plus R plus Z happen all at the same time, intervene now. This was incredibly important when we were trying to put together systems specifically for veterans, when we're trying to stop veteran suicide. We're trying to look and see what was changing in their environment. What were they self-isolating? Were they started to enter into or saying things like they were changing their activities, or what would they say online? Someone in their mind just said, now this guy's maybe talking too much Big Brother stuff. Do we really want to know about all of that? Well, what I'll recommend is that by itself, no, that might be a little too Big Brotherish, but this is where we can opt in. If I go to that doctor's appointment tonight at 5 and I go and I come home, I'm all of a sudden incredibly motivated to want to change a bunch of different things. I'm incredibly motivated to want to know what I can do to stay healthy longer. I'm not saying this is for everyone, but there's several disease states specifically. And when you look at the combined comorbidity of behavioral and physical health, that now is a time for data as a service to really be considered. We know that there is a plethora, a gold mine of information, whether it be sensor data, whether it be self-reported vital signs, whether it's really looking at the consumer behavior of what you're watching on TV or what you're Googling or any number of different things. When you can bring that together with other type of data, there is so much to be learned, and we're not even really touching on it altogether yet. But 90% of healthcare happens outside of that facility. So I think it's important for us to take a quick look and understand what might be a way of pulling together actionable information. So when I start on the left-hand side, it's really, how do I address the total patient, the physical health and the behavioral health? Gosh, what is a way that we could find a way, and I know that this is aspirational, but the claims data is looking in the rearview mirror. You've got EMRs, which still are trying to pull together a bunch of different data elements, but it doesn't always have that actionable information side. RPM, however, remote patient monitoring, at least shows you what is relevant today. And as I mentioned earlier, as soon as you leave the hospital system, the EMRs pretty much go blind. But if you could pull in remote data monitoring, if you could pull in the observable insights from a family member, from a caregiver, from somebody that is, again, going to be that wingman that would look over and be able to say, hey, there's a missile that maybe is starting to come up, and if left left unaddressed, could impact that person. That's the analogy that I bring with the fighter pilot side, because we had all of this data, but it was often the voice of your wingman or your wing person in today's environment that would be able to call out to do something that was going to be listened to above all of the other noise. And that finally, as we're looking at online and active daily living, much like we heard just a second ago from Steve at alarm.com, there are so many things just with the active daily living sensors that we can pull together. So my hope as we're building this out is that we would be able, and I affectionately like to call this the so what machine. It's to pour all this data, whether we want to say it's machine learning or AI or any number of things. It's what is the so what? What is the actionable information that comes out of all of these different data elements? The non-FDA that we've heard great things from Validic, as they expand also into more FDA and others, it's to be able to take non-FDA device information, behavioral instruments, FDA devices, and then to put it together into some type of comorbidity algorithm that looks and understands that something might be directionally aiming at essentially multiple disease states or interaction between different diseases that could be accelerating or slowing down someone's total health. So my challenge for us to go as we go forward is for us to be able to look and understand how early warning systems can really be able to address things like the rising risk. What are the things which we can identify earlier than someone presenting into their annual physical or any other number of ways that we're looking at what's the speed or the rate of change that's occurring with someone in their health journey? How are we involving caregivers, family members, and then what can we do to ultimately mitigate ED admissions? As we pull all these things together, it's important for us to recognize that if we can make it easier with greater access treating and working with our clinicians to deliver care at their highest level of their licensure. That a call or a text could be helpful. If that's not working, a telehealth visit, if necessary, a face-to-face, and even some new and creative ways that I've looked at things both in Canada and some other locations that they're using 911 to be able to treat someone in their home without having to transport them potentially, and then ultimately into the emergency department if that's what it takes. But folks, this is where I'm hopeful that we can all as an industry figure out what can we do to remove some of the barriers to success. Because as we're looking at right now, and what I think is going to be the greatest challenge is that for us as an industry, we need to lead through this change and this transformation like never before. It's to find a way to pull together and collaborate in a way that we can drive through all of those, the quadruple aim, to be able to adjust as we're going from fee-for-service to value-based care, that the care delivery is going to be more expansive to both inpatient and outpatient and in the home, for us to use data like never before, and to be sure we're looking at patient-generated information, the psycho and social determinants of health, and the behavioral data to look at that entire person. And that overall we'll be able to do is transform a provider optimized experience and a consumer optimized experience. So collectively, we'll be able to live healthier, more fulfilling lives. I hope that's helpful for you all. It's a dream that I've been working on for over a decade, and I'm hopeful that it won't take another decade before we'll realize many of the benefits. Thanks, and have a great day.
Oh, thank you, Michael. Definitely, I definitely appreciate all of that. A very, very interesting discussion. But yeah, I think that's about all we have time for. So I'm very happy to cut now to our video presentation and then our executive spotlight with Heal.
All right, thank you very much.
As of 2021, almost 25% of U.S. broadband households report either currently caring for an aging loved one or expecting to provide care in the next 5 years. The pandemic has exposed the vulnerability of our senior population. An increasing number of seniors and caregivers seek solutions that keep them both safe and able to live independently. New tools like video conferencing, grocery delivery, e-commerce, telemedicine, and independent living solutions are available to serve this growing market. Retailers, service providers, and device manufacturers are expanding the market of technology solutions that support independent and safe living for seniors and caretakers. Our latest research, Health and Wellness Senior Assistance Technology, quantifies the impact of the COVID-19 crisis on seniors and family caregivers, assessing concerns, pain points, and demand for technology products and services, including trending data from our past surveys. For more information on this new research, please contact our sales team at sales@parksassociates.com.
If you miss a live session, you can go back at any time to watch on demand. Go to Watch Replays and click on the session that you want to view. Have you created your own event agenda and swap card? Visit the Agenda and Watch Replay tabs to add sessions that interest you to your own event. You can go back to My Event to revisit any bookmarked sessions, sponsors, and items. We want to make sure that you're connecting with our industry-leading sponsors. You can interact with them by visiting the Booths and the Sponsor tab. You can also bookmark sponsors or add items to your event to view later. Sponsors have uploaded extra materials for attendees. Make sure to visit sponsors that interest you to chat with one of their team members or save documents for later. We have dedicated meeting slots set up for break times between sessions. Continue the discussion by requesting meetings from others in the SwapCard platform. Schedule a meeting with another attendee or a sponsor by visiting their page. The panelists and speakers will be addressing your questions live during the stream. During the stream, use the question tab to ask your questions early in the presentation. Go to the poll tab to answer polls that will be discussed during the live